Hello, class. We are Group 5, and today we'll be teaching you about Tay-Sachs and Niemann-Pick disease. Tay-Sachs and Niemann-Pick disease are lysosomal storage diseases, which just means that they're characterized by an abnormal buildup of toxic material in the cells, resulting from enzyme deficiency. The recycling center of the cell, and it's rich in macrophages, and the macrophages break down toxic materials in the cell. Lysosomal storage diseases are also considered genetic disorders, and there's more than 50 known types. Tay-Sachs and Niemann-Pick disease are also called autosomal recessive diseases, and we all know that that means that if two of the parents are carriers, then their children will have a 25% chance of being affected by the mutation. So first we'll start with Tay-Sachs disease. For the pathophysiology, Tay-Sachs disease is a neurodegenerative disorder, and it consists of mutations on the HEX-A gene on chromosome 15, and it causes a deficiency or complete loss of lysosomal enzyme beta-hexoaminidase A, which is necessary for the breakdown of lipids. The lack of HEX-A enzyme causes an accumulation of lipids, the GM2 gangliosides, in the lysosomes of the central nervous system, and that causes neural cell toxicity, cell death, and damage to the surrounding tissues in the brain and spinal cord. So there's three types of Tay-Sachs disease. The first and most common is the infantile Tay-Sachs, and it's characterized by an almost complete loss of the HEX-A enzyme. The disorder is rapidly progressive, and the onset of the symptoms are between 3 to 6 months old, with fatality or life-threatening around 3 to 5 years old of age. The two next parts of the disease, next forms of the disease, are very rare. They are juvenile Tay-Sachs and late onset Tay-Sachs for adults. The juvenile form has an onset of symptoms between 2 to 10 years old, and the adult form varies, so symptoms can start between 20 or 70 years old. It varies a lot. And both of the diseases are characterized of a deficiency of the HEX-A enzyme, and they're both slow progression of the destruction of the central nervous system. For the clinical manifestations, the signs and symptoms vary depending on the disorder. But most commonly in infants, they will experience hypotonia, which is muscle weakness, which will make them seem like floppy and limp when you pick them up. It's called floppy baby. And they'll also experience psychomotor regression, meaning that if they were able to crawl or if they were able to sit up on their own, all of a sudden now they can't because of the symptoms of the disorder. And also another common manifestation would be the cherry red spot in the macula of the eye that can be seen on eye exams. So for our assessments, we would want to focus on vital signs because of the weight of the patient. If they're below weight, we know that that might be due to muscle wasting. Also, we want to look at test their reflexes, if they are experiencing loss of coordination, or if they're having problems with vision, hearing, and speech. Some questions that we might ask during our assessment would be, does your infant's body seem to lack structure, or are they experiencing like floppiness? Has your infant stopped crawling around, or are they unable to sit up on their own anymore? And for adults, we can ask if they're experiencing clumsiness or if they've been falling down a lot, and or if they're experiencing speech problems. So pop quiz time. All right. So Tay-Sachs disease is caused by a deficiency of, you guessed it, it's beta-hexoaminidase A, the lysosomal enzyme. All right, and so now we just have a quick little cartoon that kind of shows the different signs and symptoms of Tay-Sachs disease. So you can take a look at that when you're ready. Now we're going to move on to diagnosis.
So to diagnose Tay-Sachs, we look at the patient's symptoms, such as muscle weakness, loss of coordination, loss of vision, slurred speech. And we also look at family history. Good thing to know is that this disease is most common with Ashkenazi Jewish heritage. And a diagnostic test for this is a blood test that checks for the beta hexoaminidase A levels. And we can also do molecular genetic testing that looks for the hex A gene, which is responsible for the production of the beta hexoaminidase A enzyme. Lastly, we can do an eye exam to look for the cherry red dot in the macula. Next. So for treatment options, right now, Tay-Sachs does not have a cure. We only have palliative care, which is just basically making the patient comfortable as possible. We have anti-epileptics and anticonvulsants for seizures. We have respiratory care to remove excess mucus in the lungs. We can put an NG tube for patients that have a hard time swallowing, and physical therapy to prevent or slow down muscle atrophy. Next. For patient education, we have that expected mothers can opt for prenatal diagnosis through amniocentesis and chorionic villus sampling. And amniocentesis is just getting a sample of the amniotic fluid while the fetus is still in the uterus. And this is just checking for their hex A gene. And also for the parents of infants with Tay-Sachs, you should know that at 4 to 5 years of age, children have their nervous system severely affected, and that it may eventually result in respiratory failure. For juvenile and late onset Tay-Sachs, symptoms are less severe since their progression is slower compared to infantile. Weakness of proximal muscles is common for all Tay-Sachs patients. That's why we always offer physical therapy for treatment. And lastly, psychiatric episodes are very prominent in 40% of late onset patients. So, what treatment option is available for patients with Tay-Sachs disease? Like we mentioned before, Tay-Sachs does not have a cure yet, so we only have palliative care as a treatment option for Tay-Sachs.
Moving on to Niemann-Pick disease. Next. Niemann-Pick disease there are 4 types, and it's broken down into 2 groups. The first group will be type A, NPD-A, and type B, which is NPD-B. The second group will be type C, that has type C1, NPC1, and type C2, NPC2. Next. So with type A and type B, there's a mutation of the sphingomyelin phosphodiesterase 1. Well, with this mutation, it caused a low production of acid sphingomyelinase. With type A, there's an absence of this enzyme. Type B, there's a very little of these enzymes. Now, without these enzymes, the lysosome cannot break down the sphingomyelin of any large molecules. Since they can't break it down, it's going to accumulate in cells, such as macrophages, which will lead to damage and death of intracellular recycling and organelles. That will cause the deterioration of organs such as the lungs, the brain, the spleen, the liver, or the bones. Next. For type C, it's a mutation of the NPC1 or NPC2 genes, which will decrease the production of proteins that assist in movements of lipids between cell and within cell. take a look at the diagram on the upper right corner. You'll see the lysosome in a cell, and you'll see the NPC2 within the lysosome and NPC1 outside of the lysosome, and they're trying to transport a lipid. With type C, you'll see accumulation of cholesterols, lipid more, and of course other lipids too. With accumulation of these lipids in it, because they cannot, the dysfunction of the movement of the protein movement cannot move the lipids out, it's going to lead to cell dysfunction and cell death. In the peripheral tissues, there's going to be buildups of mostly cholesterols. And with the buildups, it will lead to the dysfunctions of organs and tissues. With the brain, you'll see an accumulation of glycosphingolipids and cholesterols, which type C will mostly impact, and you'll see a deterioration of the cerebellum and the whole brain. Next. For type A clinical manifestations and assessments, you'll commonly see the type A in Ashkenazi Jewish population. Now this is also common for type B and type C. For type A, it's an early onset in life. So it's very severe, fatal, and death occurs between the age of 2 to 4. The common symptoms and signs that you'll see is the abdominal swelling between ages of 3 to 6 months, which you'll see a sign of jaundice due to the enlargement of spleen and liver. Progressive deterioration of nervous system, cherry red spot affects macula, and also in the late stage, the interstitial lung disease, which is fatal by age 3. Next. For type B, you'll see most commonly the first sign that's common will be a mild or profound enlargement of the spleen and liver, which is mild hepatosplenomegaly. And you'll see a progressive splenomegaly, which you'll see a decrease in platelets, decrease in white blood cell, decrease in lung functions, and an increase in cholesterol or other lipids type. For type B, you'll mostly find the accumulation of the sphingomyelin. Now also, type B is not as severe as type A, and the onset will be late childhood or teenagers. And it also does not affect the brain, the nervous system. Now with type C, it affects all ethnicity, and the most common sign will be the progressive neurological and developmental problems. The progressive neurological problems will be such as dementia. Early infantile onset, you'll see jaundice and delay in developmental motor milestone. Also, developmental regression sets in later. For late infantile and childhood onset, the first common sign you'll typically see clumsiness. You'll notice learning difficulties down to slurred speech and seizures or cataplexy, which is short loss of voluntary muscle tone. Now for teenagers and adult onset, you'll see the progressive cognitive impairment and also some psychiatric symptoms of similar to schizophrenia and depression. In the late illness or in the late stages, you'll see patients that had lost their capability to walk, talk, swallow, and also respiratory failure, which is the frequent cause of death in type C patients. Next. This is a diagram depicting the type C, how it impacts the brain. Next. Check on learning. Which population of people are at the highest risk for Niemann-Pick and Tay-Sachs disease? Ashkenazi Jewish population. So this is a cartoon. If you can't remember anything, it's a cartoon of the Niemann-Pick. You'll see the symptoms on this cartoon. Next.
So in the diagnosis of Niemann-Pick disease, we want to start with a physical examination and a family history. Also, one thing to keep in mind is that the symptoms might be similar to other diseases, so a combination of tests are going to be done to confirm the diagnosis. So the first thing we do is a clinical examination, which is we're going to look on the abdominal region to check for swelling. We want to look for shortness of breath, which could indicate some kind of a lung obstruction or an infection. They may have difficulty swallowing, slurred speech, loss of motor skills. In newborns, you're going to see jaundice, and that's going to be a present symptom. They may involve an ophthalmologist, and that way we can get an eye exam and they can look for the cherry red spots on the back of the macula, as well as difficulty in movement on the eyes, especially vertically up and down. These patients may also have seizures or have hypersensitivity to touch. So one thing you can do before the baby is born is we can do prenatal testing, which would involve an ultrasound, which will detect the enlargement of liver or spleen, and this will be for type C patients. Also, the amniocentesis is able to test the DNA of the unborn baby so that we can see if there's any gene mutations before they're even born. Another test for we can do is an MRI test, and there's a few things we can look for on these. For this, towards the spleen and liver, we're going to be looking for accumulations of the lipid-laden macrophages, and then that's when you'll see the enlarged organs. As far as the brain goes, at the beginning stages, there isn't going to be anything really showing on the MRI because the symptoms are going to appear before the loss of brain cells. But once the brain cell does show some loss, you're going to see atrophy in the cerebellum. Also, in the bone marrow, they're going to be able to evaluate that for low T1 signals, which means that in the bone marrow, there will be a loss of fatty tissue and an increase in water content. Next. So a blood test is the best test, which will be able to confirm the diagnosis, and that's because for type A or B, we'll be able to measure the amount of sphingomyelinase in the white blood cells. And for type C, we can do a skin biopsy, which is going to assess how the cells are moving and storing the cholesterol. Next. So now we have a quiz question. Who remembers which genes are responsible for transporting cholesterol within and out of the lysosome so that it is able to be metabolized? Next. You're right, it's NPC1 and NPC2 genes. And how we find that out, next, is on a genetics and DNA test. So what we do on that is, as I said before, we can do the amniocentesis to check for the mutations in the NPC1 and NPC2 genes. Also, we'd like to test the parents to determine if they're carriers for any of the 4 types of Niemann-Pick disease. Next. Now, the kind of treatments that are going to be available, unfortunately, there is no cure for Niemann-Pick disease at this time either, but they are working on some experimental drugs and clinical trials. So for type A, we can do supportive therapies, which are going to include cardiology, pulmonology, liver and spleen specialists, gastroenterologists, nutritionists, and physical therapies. And this all depends on what kind of symptoms the patient is having. Then in type B, we're doing some clinical trials right now for enzyme replacements. Hopefully they'll find one that will work, and then that could head towards a cure as well. For type C, the experimental drugs that are being tested right now are depending on the age of the patient. So the goal is to slow the progression of neurological damage or to delay the symptoms and decrease the storage of the cholesterol in the liver. Next. So the most important part is the patient education, because what we need to teach the families is how to cope with this diagnosis. And since there's no cure at this time, the disease can be fatal and they're not alone. So we need to let them know that there's support groups and foundations out there that they can go to get some support and answering a lot of questions. And those are listed here. One thing to recommend to them is make every day special, because the memories that they create now are going to help them overcome any difficulties or hard days they may face in the future. And counseling as a family is recommended because this can be hard on everybody. So what is the cause? they're going to ask, what is the cause? So for type A and B, there's a deficiency of the enzymes that are needed to break down these lipids. That the reason why they're not working is there's a mutation in the SPMD1 gene. And then for type C, there's also a mutation in the gene, but their mutation is in a different gene, which is the transporting genes that move the cholesterol out of the cells. The accumulation of lipids and cholesterol in the cells are going to cause cell death and cell damage, and eventually cause organ damage. So these mutations are hereditary. They're passed down from the parents. So one question people ask is, how do I manage those symptoms? So we recommend eating a healthy diet rich in calcium and vitamin D. Do not overuse cigarettes or alcohol. One thing to do definitely is for exercising. Do some gentle exercises that keep the lungs working and keep the bones active. And then also children are recommended, especially when they have the enlarged spleen or liver, to wear protective covering over those areas when they're playing so that they don't accidentally get a ball hit to them or somebody kicks them or something like that. And that way they can be safer. Next. So we would like to thank you for listening to our presentation today, and we hope you learned something and had fun with the quizzes. And if you have any questions, we're here to talk. Thank you so much.